I'm going to start by introducing our speaker tonight, even though he introduced himself already. But Aaron Stocks is an operations manager with the Compass program, where he oversees a team of case managers for the East region. He works closely with his counterpart to focus on the day-to-day operations and contributes to the strategic direction of the program. He is passionate about working closely with his team members and helping them grow professionally. Aaron lives in Point of Rocks, Maryland, with his wife Brady and 2 dogs, Jules and Rusty. In his spare time, he enjoys golfing, video games, and keeping up with too many TV series. And I'm really glad you could join us tonight. We've had you before, and people got a lot of information from you, so I know it'll be similar tonight. So thank you very much.
Well, thanks for having me, Jennifer. Again, I'd love to be there in person, but it's kind of the world that we live in now. And now that I'm listening back to my introduction, it's almost as if I'm 35 years old, going on 14 with the hobbies that I've listed out. But that's okay, right? So again, we're going to dive in. We're going to get into the presentation. I'm going to talk about what Compass is, who the services are for, talk a little bit about some case examples. I know people really resonate whenever I talk about some of the cases that we helped in the past. We're going to talk about a little bit about what we've been seeing in the CF community in relation to COVID, right? What are some of the things that people are struggling with? It's kind of accentuated some of the challenges that people are going through and how we've been able to help there. But again, I'd love to get questions, any feedback, any experiences that you've had with us, positive or negative. We are always striving to get better. The best that we can, or be the best that we can when it comes to our customer service for the CF community. So if you don't have anything else, why don't we just dive in? All right, and let's see if I can share my screen. All right, someone just give me a thumbs up if you can see the slides. Anybody? All right, fantastic. So CF Foundation Compass. What is Compass, right? Many years ago, we started out as something called CFPAF, which was the Cystic Fibrosis Patient Assistance Foundation. We started out as a copay assistance program. We quickly realized that there are so many other things that people in the CF community could use help with, other than just paying for copays for medications. So over the years, we've expanded our services. For a little while, we called ourselves something called PARC, which stood for Patient Assistance Resource Center. But when we had that name, we had several different programs, and people didn't really know that all of these programs were being provided by the CF Foundation. So that's when we made the strategic decision to rebrand and call ourselves Compass, right? Which we think is incredibly fitting because we help people navigate different issues. So what are those issues? We kind of break them down into 4 different areas or categories. The first one listed there, insurance. For many years now, I have always said that insurance is our bread and butter because it's one of the most complicated things in the United States that I think anybody could go through. Preston Campbell, our previous CEO, he used to tell people that he has friends and family that have 2 PhDs and still can't figure out health insurance in the United States. It's that complicated. So what we do, many different areas with insurance. We can help compare insurance options, whether it be through your employer, whether it be through the healthcare marketplace. If you're looking at something privately, Medicare plans, Medicaid MCO plans, they're all very different languages. It's difficult to understand. So our team can help you compare options and think about what are the priorities for your health. And we take a look at those different areas of the benefits to kind of help you understand the differences of the plans and which one might be the best fit. And then the other end of that is, even when you think you enroll in a plan that you think is going to cover everything that you need, insurance companies don't always cooperate the way that we want them to cooperate. So we can kind of help or jump in and help either facilitate, work very closely with the care teams and trying to alleviate some of those issues. You know, one of the top issues that happened back in the beginning of the year, right, is the approval of Trikafta. Well, of course, we were all very excited about that, but insurance companies weren't necessarily as excited as we are, right? So there are lots of barriers, lots of roadblocks, and people being able to get the medication. Insurance companies didn't necessarily put Trikafta on their drug list as soon as we wanted them to. So there's lots of documentation, lots of things that we have to, lots of hoops that we have to jump through and trying to get things covered. So essentially any type of challenge that you might be having with your insurance company, our case managers can work very closely in trying to resolve those issues. The other category we call financial. So one of the things we were actually meetings today, and it really resonates with me, is that coverage doesn't necessarily equate to access. And what that means is, even if something is covered, it could still leave such a high out-of-pocket cost for people with CF and their families that it's still just not attainable, right? An example of that is, think about Pulmozyme. Pulmozyme at cost cash price is anywhere from $2,500 to $3,000 per month without insurance. So even if you have insurance, if you have to pay 20% co-insurance, right? 20% co-insurance of $3,000 is still a lot of money. Not many people have $600 per month to pay for a drug like that. And that's just one drug. So what our team can do is to make sure that we're connecting you with all of the resources and programs to get those copays down as low as possible, and sometimes even zero, depending on eligibility and what's out there, to really try to alleviate a lot of those costs. We all know that people with CF, we're not just taking one drug. We're not just taking two drugs. It's a whole list. So even if you have copays that are $10 to $15, which doesn't seem like a lot, it really adds up when you look at the entire list of drugs that an individual might be taking. Third there is legal. We work very closely with a law firm down in Texas, Suffian and Passamano. A lot of you might be familiar with Beth Suffian. She is an attorney. She has CF herself. She is an unbelievable advocate for people with CF and their families. So her office specializes in Social Security, disability, challenges within the workplace, and challenges within school. Those two were incredibly popular this year. Just thinking about everything that's going on with the pandemic. People were trying to navigate going back to work, employers telling people that they have to come back to work, and our family's not necessarily feeling safe. Challenges with school, 504 plans. She is great at helping people navigating those issues and giving some guidance. And then the ever popular other. What does other mean? Well, other means it's kind of the sky's the limit. As long as some of these things are within our scope of services, we can help with almost anything, ranging from if people need help paying for rent, people need help paying for utilities, looking for scholarships, looking for exercise grants, essentially anything. So I want to leave that bullet point there in that over the next 20, 25 minutes, I tend to talk a lot. If there is anything that you want to, or you might think, well, no, Compass can't help with that. Feel free to put it in the chat. We can talk about it, or take yourself off mute. Again, I want to make this as interactive as possible. Or if you want to shoot me an email in private and talk about any of the challenges that you think we might be able to help with, I can provide that, and we definitely want to help. Eligibility. There is sometimes this, there's some confusion in that people choose not to contact us because they just assume that they're not eligible. We essentially do not have eligibility, especially when it comes to financial criteria. We are eligible to almost everybody in the CF community, including people who are pre and post transplant, family members that are living directly in their household. An example that I love to use is that if people need help comparing insurance plans and you're looking at a plan for your entire family, we're not just going to look at that plan for the person with CF. We want to make sure that your entire family is being covered for all the needs, right? So we really want to be there to take care of anything that's going to directly impact the entire family. And of course, we want to work very closely with our providers, right? We know our care teams, their most important job is taking care of us, taking care of the people with CF. And whenever we have to deal with the red tape with insurance, there's just not enough time in the day. So we want to be there to partner with our care teams, be a resource for them. It's open to anyone. It doesn't matter what type of insurance you have. It doesn't matter what the household size and income is, care center criteria. We do get our phone calls from folks who are not necessarily going to an accredited care center, just based on personal choice, or depending on where they live, they might not be able to get to an accredited care center. Compass is free. It's confidential. We are never, ever going to share any personal or health information. So whatever we talk about, it stays with us. And the other thing that I like to share here, and it's not on the slide, is that undocumented residents in the United States also definitely contact us, because again, it's confidential, it's free. We're never going to share any personal information. So whether you're a resident, if you're undocumented, it doesn't matter. As long as you have CF, we're going to be able to help. And this is just some quick contact information. And again, I can share this out at the end of the presentation. So we have an email inbox. We do have an online service request form, which I can share more information about and even provide that link. That's a great way to reach us after hours. Of course, you can always call us from 9 a.m. to 7 p.m. Eastern time. Fridays right now, it's 9 to 3 p.m. Eastern time. But one of the really cool things is that we're actually talking about and reviewing, maybe we need to expand our hours. Not everybody can call us during working hours. Sometimes it's easier to call us after work or before work. So we're looking at that, and we're also looking at other ways for people to be able to reach us. We are looking into online chat options, and in the future, is there going to be a text capability? So we want to be as available as we can for the people in the CF community. And this is always one of my favorite slides. These are the rock stars. These are the people that really make it happen, right? This is our incredible team of case managers. That top one there, these are all the folks that I work very closely with. And we have our team broken down by regions. And our goal is, so I started out as a case manager, and I think it was just Yamini and I there at the bottom when we started this whole coverage and reimbursement thing and looking for resources. So Yamini and I were responsible for knowing all the healthcare issues and the programs and the resources for the entire country. And I'm not sure how we are still sane right now, because that's a lot of information to retain. So our goal now is to assign case managers to specific states so that we can really hone in on the information and be subject matter experts and really build relationships with the care teams, with the resources, with the families, people with CF. our goal is to make this as personalized as we possibly can. So there are a couple of case managers that are actually assigned to North Carolina. Let me move this over a little bit. So that's going to be Blake there at the top. And Lex, where is Lex? She's down there in the bottom left-hand corner, and Victor. Those are going to be the people that if you call or send an email and have questions and would like to look for resources, more than likely the case is going to be assigned to one of those three people, because we want to be the knowledge experts for everything available in North Carolina. So in North Carolina, just a couple of stats here. In 2019, we received 200 cases in North Carolina. This year so far, we're at 127, and we're not even through the year yet, and we're just getting into the busiest part of our year. We'll talk about that in a few minutes. As of right now, I think the last time that we checked, we had 1,100 people living in North Carolina with CF. Any questions so far? Any comments, feedback? Anything that's still a little unclear? Perfect. All right, moving on. Insurance issues. This is my favorite thing to talk about. Because I loved fighting with insurance companies and making sure that people with CF get access to the incredibly important care that they need. So again, I talked about new insurance coverage. Many of you may have already been going through this or will be going through it over the next 2 months. It's open enrollment time. Open enrollment or choosing insurance, I think, is one of the most important decisions that people with CF and their families can make. Because when that plan starts for 365 days, if your care team or if your care center isn't in network, if you're on a plan that they just absolutely refuse to cover a drug or a piece of equipment that you need, it's going to make life incredibly difficult. And obviously we need access to those things, right? It's all about that comprehensive care. If we don't have access to it, then obviously it's going to make life very, very difficult for an entire year. So I've always said that this is one of the most important decisions that people with CF and their families can make. So again, we can help compare coverage that's being offered by employers, looking at private plans, Medicare, which we could probably talk for several hours about Medicare because it is so complicated, navigating Medicaid, and of course the health insurance marketplace. Right. One of the really cool things that we do is we want to be able to provide additional tools, right? Because we've learned about people with CF in that, you know, you have people on one end that they just say, look, I don't understand this stuff. It is super complicated. I really need you to walk me through every step and help me understand. And then we have other individuals out there that just say, hey, can you put something together so I can kind of teach myself? You know, I want to be able to do this on my own, and we want to be able to empower people to do that, right? So we've created Navigating CF. So it's a tool to help learn the basics of health insurance. And then anywhere in between there, of course, we're going to be able to be available to help answer questions and help navigate things. But Navigating CF is a great tool to be able to basically self-teach some insurance concepts and to eventually hopefully be able to do some of these comparisons on your own. And then the other visual there is what we call our comparison checklist. If you've ever seen a document that's called a summary of benefits, it is a very, very complicated document. Sometimes you'll get a packet from your employer of all the insurance details, but it's probably 27 pages long. So what our team will do, and we think it's such a great resource, is to pick out all of those benefits for the insurance plans that you have to compare and put it all on one sheet so you can see it side by side. And then we can walk through. We started asking people better questions about, you know, it's not just about checking your drug formulary to make sure that your drugs are on the list. It's not just about making sure that your care center is in network. Yes, of course, those two things are incredibly important, but for each people or for each person with CF, the journey looks very different, right? And we all have very different priorities. So, where one person could be coming up on looking into replacing their vest, right? They have a very old model, and we all know about some of these newer models that are coming out that are, you don't have to be plugged into the wall, and they're very quiet, but they're also still very expensive, right? And then on the other hand, we have individuals and families that are, starting the transplant journey, and that in itself is very complicated. So we do a great job during what we call our intake in making sure that we get as much information as possible about what's important to you for your insurance comparison, and we can kind of highlight those benefits and walk through each of those elements together. Any questions about comparing insurance plans, open enrollment? Perfect, moving on. All right, and again, some of these adverse insurance coverage issues. So even when you pick a plan during open enrollment and you're feeling good about your decision, you think everything's gonna be covered, sometimes insurance companies just don't cooperate the way that we want them to. So we can experience unexpected medical bills, coordinating benefits. Sometimes you have more than one insurance plan. You could be on mom's dad and you can be on dad's plan. You can have Medicaid as a secondary. And sometimes they don't talk to each other, or what happens if insurance A says you have to use this pharmacy, but insurance B says that you have to use this pharmacy. We can kind of help step in and facilitate getting exceptions to make sure that you're able to maximize your benefits. Switching pharmacies, that happens a lot with some of these limited distribution drugs, right? So if you're on a modulator like Kalydeco or Symdeko or Cambie or Trikafta, there's only a handful of pharmacies that have that drug. So for example, CVS Caremark is contracted with a lot of insurance plans, but CVS Caremark doesn't carry the modulators anymore. So what do you do if you need to just get that one drug from one of the limited distribution pharmacies? We can try to step in and work with the care team and try to make that process a little more seamless. Believe it or not, there are insurance plans, and it's happening more and more with what's called self-funded insurance. And that in the middle of the year, when you were evaluating your plan, your medication could have been on the drug list, but then in the middle of the year, your medication is it's no longer on the list, and they say that they're not going to cover that. So we can jump in with some of those situations, and we've gotten very creative sometimes based on the employer and the insurance plan. Getting network exceptions, right? What if your employer only offers an HMO and your care center only accepts plan X, Y, and Z? We can help collect what information is necessary to submit to your insurance to kind of explain to them that it's very important for continuity of care, right? To stick with your care team, especially if you've been going to a care center for so long. I think someone mentioned a little bit earlier that they were with a care center since age 2 and now they're 19. It's so important to help inform the insurance companies that, number one, people with CF just can't go to any pulmonologist down the street, right? It's all about that specialized care. And it's not just about the pulmonologist. It is the entire care team, right? And we trust our care team so much to the social worker, nurse coordinator, dietitian, respiratory therapist, mental health counselors. So it's all about the comprehensive care. So if there are any challenges in getting network exceptions, we can help and help facilitate that and getting the necessary paperwork in. And just a simple benefit verification. The example that I like to use there are new parents, right? New parents who have a child and they find out that their child has CF, their life just already got turned upside down. And in more cases than not, both of those individuals have never had to utilize their insurance. They've been healthy their entire life and really don't even know where to start. So if they have insurance, we can help do a benefit verification, even if it's just to translate some of that language. Lots of people who come into the CF community as new parents don't know what a deductible is, don't know what a maximum out of pocket is, what's the difference between a copay and co-insurance. So down to that basic level, we can help understand the benefits that families already have. Again, the financial issues. Coverage does not mean access, and we are all very aware that CF is a very, very expensive disease to live with, right? So it could range from looking for copay assistance for medications, vitamins and supplements is a very important part of our care. Medical devices, I mentioned vests earlier, right? If you've gotten a new device that's out there like the Monarch or the Aflo vest, these things are anywhere from $15,000 to $20,000. So again, if you're responsible for a co-insurance for those devices, they're incredibly expensive. But there are resources out there that can kind of offset some of those costs. Insurance premiums. We all know that just paying for your insurance plan alone is incredibly expensive. There are some resources out there that can help pay for the insurance premium. And then the big one especially in the beginning of the year is a deductible, right? If you have a high deductible plan of $5,000, $6,000 and you have to go to clinic visits, or if you do get one of these expensive devices, you're responsible for a bigger chunk in the beginning of the year if you have a high deductible plan as you would after you reach that deductible, right? So we can kind of help navigate that and offset some of the costs. That's what we consider financial resources. Anything that helps pay for medical care. Questions, feedback, concerns?
I have a question. Sorry, this is Ellen. I apologize if you mentioned this earlier, but you talked about, it's confidential, it's free. What about Spanish-speaking families?
Oh my goodness, how did I not touch on that? Yes, we do have Spanish-speaking case managers. Both Martha and Aaron Fleming is also a team member who wasn't listed on that page. We do have Spanish-speaking our team members, and we are looking to get more people on the team that are bilingual. But let's say, Martha's out of the office or her caseload is, really high, so she's not available. We also partner with Language Line too, to make sure that we can have those conversations to be able to help the Spanish-speaking community, because that's the second highest population for people with CF, right? And we recognize that we definitely need to be a resource for them as well. So I'm glad that you brought that up.
That's awesome. Thank you.
Hey, Aaron.
Yeah.
It's Eileen, and you may be planning to cover this in your presentation, but I just wanted to know if you could speak a little bit about what Compass does to provide services like in a disaster management situation, because I'm thinking about our folks down in Louisiana right now, and I know Raleigh's been hit by a few big storms, and you guys do a marvelous job providing services in that area. So you may already have a plan to cover it, but, I just wanted to chime in there and make sure you guys are all given credit for everything you do in disaster management, as well as everything you do on a daily basis.
Thanks, Eileen. It didn't look like that Jackie included it in this presentation, but I think now's a really good time to talk about it too, because I wanted this to be organic. Those poor people down in Louisiana this year, man, we recognized that these natural disasters, again, like people with CF and their families, life is already hard enough. And then whenever you live in an area that's impacted by these natural disasters, like the hurricanes and the wildfires, we recognized that we needed to give them additional support. So we do have a Compass disaster team that we are checking phones, checking emails after hours. If it's an urgent issue, we step in, give the person a call back, make sure that they're safe. If there are resources that we can provide to them after hours, we take shifts, and our disaster team feels incredibly passionate about being available for people, or anyone that's been impacted by the disaster. And Eileen, I don't know if you want to kind of tag team this, but the entire foundation recognized that this was a problem. And we have an entire playbook. We have phone calls. We have touch bases with people that are in the area that are being impacted because they're on the ground, right? So they're going to know before we do what the environment's looking like, what they're hearing from their local news. They sometimes get connected to resources before we do. So we are taking this as a very holistic approach because obviously, the disasters are incredibly devastating.
Yeah, and I'll just, chime in real quick because I know Kay and her team have been part of our disaster management playbook conversations on, a couple of occasions. I know the care center's been involved. So, just for any family that's affected on the phone, know that, if God forbid you're impacted by any sort of disaster and you need services or help, Compass is kind of your go-to to kind of be there for you. So just wanted to bring that up.
Yeah, thank you, Eileen. I'm really glad that you highlighted that. It's something that the entire foundation and Compass, we feel very passionate about being there to support the people who are being impacted by any of the natural disasters.
And Erin, just one other thing too, it's important to mention that with the Compass team, the chapters are also connected to the care centers so that the messages that are going out to families and people living with CF are consistent, they're reliable, and supporting all these different areas. So it's a great team effort. Thank you for all you do.
Any questions about the disaster team? Again, if you know anybody in the areas that are being impacted, definitely have them reach out to us because again, we've extended our availability and we want to make sure that we're there to support. All right, so moving into the legal issues. I think I probably skipped ahead a little bit earlier, but again, just to kind of reiterate, we work very closely with Suffian and Passamano. They're unbelievable advocates. So anytime, rights are being violated at school or in the workplace, questions about Social Security and disability, or even insurance, they are the experts, and we like to refer people over to them for guidance. Anything outside of those first 3 bullet points, it's kind of outside of Beth's expertise, but that doesn't mean that we're not going to look for other legal resources. So we've had calls for questions about, housing at college, tenant issues, those types of things. We can still look for outside legal resources that might be able to provide guidance that's not necessarily within Suffian and Passamano's expertise. So we would kind of treat that as one of our other cases, but specifically for legal issues. Do you have a question there? Okay, perfect. Moving along. All right, other issues. Other issues, that's always the exciting thing to talk about because the sky is the limit, right? So here is a list of some of the things that we consider to be other life issues. But again, it's not limited to this list. So anything from life transitions, looking for food resources, helping with utility bills, looking for resources to help catch up on rent, home repairs, fitness programs, scholarships, genetic testing. Again, the list goes on and on and on. I think Jackie included a stat here. We helped 108 people find scholarship opportunities just within the last year, which is really cool because there's lots of opportunities out there for people for people with CF specifically to provide those scholarships to our community. All right, so people always like the examples, right? It's nice to list out the bullets of the topics that we can help with, but we also like to provide some case examples, right? So we had a case, this actually just happened a couple of weeks ago, where a family was running into a coordination of benefits issue, but they didn't really know about it. Sometimes the bills can even come months after a clinic visit. So because of this coordination of benefits issue, this family had accumulated $48,000 in medical bills. It was incredible. It was a mess. Our team member, Sarah, was able to kind of jump in, navigate with the insurance to say, no, this payer should have been billed first. You're billing the wrong insurance. So coordination of benefits issues, lots of times secondary is going to follow what primary does, right? So if primary doesn't pay, secondary is going to say, well, we're not paying either because those guys didn't pay. So after lots of hard work, Sarah was able to triage this case. All $48,000 was taken care of for this family. It was a huge, huge relief. Copay assistance for Pulmozyme, the exact example that I gave, right? People on Medicare. So the way that you bill Pulmozyme when you're on Medicare is that it doesn't necessarily get billed to the same part of Medicare. So Pulmozyme is billed under Part B. The problem with that is under Part B, you're responsible for 20% of everything. So again, 20% of $3,000 for someone on Medicare whose income is very limited, that's $600 a month. And you're not even talking about some of the other drugs. Part of the challenge for people on Medicare as well is that you can't necessarily take advantage of the manufacturer copay programs because you're not eligible because you have public insurance. So we have lots of these examples where we're able to help connect them with a Health Well Foundation or the Assistance Fund or the Patient Assistance Foundation to make sure that they're getting the same help that they need, right? Especially for that population because they're on a limited income. We receive calls from people who children need to be able to carry their enzymes in school, right? And not necessarily have to go to the nurse's office every time that you eat. That's going to be a perfect example of a case that we would send over to Beth to be able to provide some guidance and talking points and some of the information to give to the school to kind of help educate them and to be able for any of the children to be able to carry their enzymes with them. And then exercise grants, right? Airway clearance, that's a big thing for all people with CF. Especially now, we're living in very different times and going to the gym is just not a good idea. So there's lots of organizations out there right now who have actually changed their criteria to be able to help with exercise equipment, whether it be weights, it could be exercise bike or whatever the person's interested in. So we've actually been getting a lot of those cases, and some of the organizations that we know have actually changed their criteria to be able to help with equipment because we all know how important exercise is for people with CF. All right, so getting into the elephant in everyone's room, how we have seen, at least from a Compass perspective, how COVID-19 has impacted the CF community. The first thing that we always like to talk about when we're getting into coronavirus and COVID-19 and CF community, we encourage everyone to keep up with the information that the CDC has up on their website. They are constantly keeping that updated and putting up new information, as well as our own website. We are periodically updating our FAQs for some of the really important questions that we think that the CF community might have and might need answers to. So either one of those, I really encourage, if you have questions specifically related to COVID-19 and your loved one with CF, there's a lot of great information on both of those websites. All right. So this kind of walks you through what we've seen in relation to COVID-19. We have actually received over 600 phone calls since March. for people being directly impacted by COVID-19. We've really seen, we've seen it kind of go through a transition in that in the very beginning, just like the rest of the world, right? We were scared of risk of exposure in public settings. What do? I can't go back to school, or I can't go back to work. Are clinics even open? Am I going to be able to do or go to my clinic visit? Which now telehealth is becoming a really, really big thing in the CF community. What's going to happen with the CF events? Or can I go to a restaurant? Is it even safe to go to the grocery store? We were flooded with those questions in the beginning, right? And then we transitioned to shortages of supplies. People with CF weren't necessarily fighting with other people with CF for masks and hand sanitizers and cleaning supplies. We were fighting with the rest of the world, right? So there were shortages everywhere. So we started looking for places where we could get resources. And then it transitioned into the work accommodations and legal protections. Essential workers coming up with a template letter to say, look, totally understand that your business is opening back up, but it is not safe for me to come back to work as a parent or a person with CF because CF is a lung disease, right? So our people are more at risk. And then as people were off work for an extended period of time, we started seeing a big trend in needing help with living expenses, rent, utility, food has been a huge one. People losing their insurance because they couldn't go back to work. And now as we're going beyond that, making sure that people have access to telehealth coverage, right? The big thing that started out was home spirometers. We all know that PFTs are a very big part of our care center visits. So the foundation started an initiative in giving out home spirometers, but obviously it wasn't 30,000 home spirometers, right? Again, that's the CF population is not the only population that needs a home spirometer. So we're doing a good job of making sure that people have insurance coverage for these home spirometers and other equipment, helping navigate the interpretation of the PFT results, right? It's one thing to be able to take it and we see a number on the device, but it's important for our care team to be able to see those results as well. And now, it's cyclical, getting back into the school accommodations and the legal protections. So we are constantly monitoring what's going on in the CF community, and we're doing a great job of sharing that information internally about what's going on so we can be proactive in trying to come up with resources and answers. So again, back to the examples, food has been an incredibly big need for the CF community in relation to COVID. If people are unable to work, they don't have the money to support themselves. And we all know that food is a very big thing for people with CF anyway. We have bigger dietary needs than people are than the average person. So we've been able to find multiple food resources, sharing information with our food security committee within the foundation. That's been incredibly important to us. There was a family member actually that tested positive for COVID and had to separate from the rest of their family. So they made the decision to stay at a hotel so that they could keep their child safe. And we were actually able to find resources to be able to offset the cost of the hotel so that wasn't a financial burden for that family. And believe it or not, we've heard stories and cases of people with CF making the decision not to go back to work because they feared for their safety. And unfortunately, people are losing their jobs. They're being terminated. So again, those are great examples that we're sending people over to Suffian and Passamano for some guidance. And we've even helped put together a template letter to provide to some of the employers to help educate them. So again, I really appreciate you allowing me to come give some information. I hope that it's been helpful. And again, if you need assistance, please feel free to reach out to us. We're there for you, whether it be just from simple questions or if it is an urgent need or anything natural disaster. Again, open enrollment is starting in the next couple of weeks, so we would encourage you, if you have questions, to reach out to us sooner rather than later. It's an extremely busy time for the case managers, but we want to make sure that we get to everyone and give them a thorough comparison so that families and individuals can make an educated decision on what plan to go with. So I would encourage everyone to reach out to us early and often. But we can open it up for questions, comments. If I left anything out, I'm happy to touch on anything, or if any of the information was confusing, we'll open it up.